For today's BC COVID-19 update, I will report that we have 27 new cases who have tested positive in the province in the last 24 hours, bringing our total to 1,517. That includes 658 in Vancouver Coastal Health Region, 601 in the Fraser Health Region, 89 on Vancouver Island Health Region, 141 people in Interior Health, and 28 people in the Northern Health Region. We have, in addition, one additional long-term care facility outbreak reported in Vancouver Coastal Health in the South Granville Park Lodge. And as always, the list of the long-term care facility outbreaks will be included with the statement release. We have 20 other long-term care or assisted living facilities with ongoing active outbreaks, including 289 cases so far, 165 residents, and 124 staff. In addition, we have 3 additional positive cases at the nursery facility in the Interior Health, where we've had an ongoing outbreak and monitoring that Interior Health is doing with that premise, where we've had a number of temporary foreign workers who've tested positive. The facility outbreak at the Okanagan Correctional Center remains at a single positive case so far, but there's ongoing outbreak measures at that facility. And as we've talked about over the last few days, we have an ongoing and concerning outbreak at the Mission Medium Security Correctional Facility in the Lower Mainland. There are, as of official reports, there are 41 test positive cases. We know there's ongoing testing and cases pending, and we currently have 7 people from that facility who are in hospital in BC. In response to that, we've had an ongoing effort over this weekend to beef up the outbreak response, the infection prevention and control measures, and the investigation of the outbreak and management of the outbreak between the province, Fraser Health Authority in particular, and Correctional Services Canada. And as part of that, the hospital, Abbotsford Regional Hospital, has developed a dedicated unit to ensure that people can be safely and securely cared for, if need be, in hospital. And in addition, Fraser Health is looking at redeploying the mobile medical unit that we have in the province that is able to look after people in a hospital setting and include critical care if need be. This mobile medical unit has been set up at the Vancouver Convention Centre, but it will be redeployed to the Abbotsford area to provide additional support for this ongoing and very concerning outbreak that we have at the Mission Correctional Facility. In addition, right now we have 134 people in British Columbia who are hospitalized, and of those, 58 are in critical care ICU. We have an additional 3 deaths to report today, bringing our total of people who have died from COVID-19 in BC to 72. All 3 of these were deaths that occurred in our long-term care homes, 2 in Vancouver Coastal and 1 in Fraser Health. And our condolences and our thoughts and prayers go out to the families and the care providers for these people who have been affected by this virus. We have 942 people who have recovered fully in BC now. I want to talk a little bit about the pandemic response and want to thank a number of people who've been really actively engaged in helping us build our firewall that we will need to continue for some time to come here in British Columbia. First, to the mobile medical unit that I mentioned, who the team is going where the need is greatest at the moment, and we appreciate their flexibility and their expertise in being able to support our response. In addition, I really want to thank the many public servants at our land and air borders, people from the public service in British Columbia who recognized that we need a need and stepped up to a call for volunteers. And they're supporting travelers who are coming back to BC to self-isolate. They're assessing their self-isolation plans and ensuring that this is done safely so that everybody can meet what we need them to do, our expectation that they self-isolate for 14 days. We are in this together, and this is our way of supporting other British Columbians who are coming back home. And we need this for now, and we need this for our future, because this is going to be an important piece that we do going forward to make sure that if and when we're at the point where we can reduce some restrictions here in British Columbia, we're not reseeding or adding more sparks to our province in people coming from around the world. And so we expect that this border control effort will be going on for some time, and we were happy to hear that the federal government has now put in place an order in council that extends these same types of supports and requirement for self-isolation plans to all of the borders in Canada, as we feel that that is an important way for us to protect ourselves going forward from this virus. And just to give you a sense of the numbers, there are 2,337 arrivals over the last few days since this was put in place in British Columbia, and 24 people have been offered accommodations. Everybody else has been supported to self-isolate. So that, I think, is a big success story and an important part of our firewall for the future. Today as well, I want to recall and talk about the fact that COVID-19 is not our only public health emergency in BC right now. 4 years ago today, we declared a public health emergency because of the overdose crises that it was affecting our communities, again, around this province, affecting our families, our brothers and sisters, our uncles, our friends. And this crisis also continues. I am acutely aware and continue to be acutely aware of the suffering and loss that is being felt by people who use drugs, by their families, and by their communities. Many have lost loved ones, and particularly the challenge of that people have around stigma and around the concern about accessing help and getting the help that they need. I want you to know that you are not alone, that we are not slowing down our response or taking our focus off the importance of being able to support people who use drugs and their families and our communities. We're not letting this crisis overtake the importance of our response to our overdose crises here and the work that we need to do to continue to support people who use drugs. We have teams that have come together to address these two emergencies and dedicated to providing support to people who are at risk of both of these crises. We are working diligently. There have been a number of movements already, and you've heard from Minister Darcy around this, around emergency housing options, and we are continuing to work on making sure that people who need those housing options are able to access them in the coming days. So people who are experiencing homelessness and other issues, mental health crises, along with their concerns around substance use, are able to get the support they need to effectively isolate, but also to care for their needs, their access to overdose prevention sites, the appropriate access to supervised consumption services, and some of these have had to be modified and changed, and that is a challenging thing. We've also increased and expanded our ability to provide people with pharmaceutical alternatives to what we know is an incredibly and increasingly toxic street drug supply. We also know that many of the more vulnerable people in this community are challenged now for even accessing the basics such as food. And there are many things that we're putting in place to support you and to continue to support you through these two crises. We want all of those who are living with substance use and addiction and other major health issues to know that you are not forgotten, and we are continuing to make sure that we have those safety nets in place for you. What you are doing today and what all of us in BC are doing is making a difference, and it matters. And there have been incredible sacrifices, and we are very much aware of that. But your efforts and the efforts of everybody in British Columbia to keep our communities and our families safe and to contribute has made a difference in our collective well-being.